Well, good morning, everyone. Thank you for that introduction. We will go ahead and get started. So this case series is looking at innovative solutions in complex back closures using Kerecis Omega-3 Surgibind, which is a fish skin graft. So as many of us know, post-operative complications such as wound dehiscence and infection are significant concerns in not only spinal surgery, but really all surgeries. These complications can lead to prolonged hospital stays, increase healthcare costs, and really reduce the quality of life of our patients. Factors like advanced age, obesity, suboptimal nutrition, posterior hardware, and the need for revision surgeries further complicate wound management techniques. Traditional wound management techniques often fall short in these complex scenarios, kind of really promoting the need for innovative solutions. So one such innovative solution that we recently have started using is Kerecis Omega-3 Surgibind, which is a fish skin graft. Now, you might all be wondering, why the heck fish skin and what is this graft? So most skin substitute products are really based on tissues of human origin, and they're not ideal substitutes because they have to undergo a lot of heavy processing needed to eliminate the risk of viral disease transmission. And really this harsh antiviral treatments they undergo remove most of the material's natural components, and it really actually makes it dissimilar to human skin. So not only has fish skin been shown to be more similar in structure to human skin than any other skin substitute, there's also no known risk of viral disease transmission, and so therefore it's only minimally processed. So it really preserves its structure and components. Fish skin graft also contains a large amount of collagen and omega-3 polyunsaturated fatty acids, so they have an amazing effect on wound regeneration. So really the aim of our study is to assess the use of this fish skin graft to reduce wound complications and facilitate healing in these complex posterior spinal revisions. All right, I'll go to the next slide. So in our case series, we assessed 6 patients undergoing cervical and lumbar revisions for spinal wounds by a single primary plastic surgeon from November 2021 to November 2023. All patients received treatment with irrigation, debridement, flat mobilization, and closure over drains with the fish skin graft application superficial to the fascia and deep to the dermis. Patient demographics, comorbidities, intraoperative and postoperative findings, and outcomes were evaluated. So as you can see on the screen, there are some intraoperative photos of our team kind of applying this fish skin graft. If you direct your attention to images A through C, these show some of our smaller surgical sites. Image A and B show sites with the fish skin biologic onlay and hardware, while image C shows a smaller surgical site before our biologic onlay is applied. So just kind of walking through the steps. And then if you direct your attention to images D through F, these show some of our larger surgical sites, and image D and E show the sites with hardware and before mobilization of the muscle and before application of the graft. And whereas image F shows the surgical site after mobilization and after the biologic onlay is applied. So this table really breaks down our patients. I think it's important to reiterate that all of these cases are revision cases, right? So our patients had an initial surgery, as you can see in the bottom row, whether that be a laminectomy or a fusion or just a drainage of an open spinal wound. And they had some sort of infection. We went back in, we opened it up, we washed it out, and we closed with this fish skin graft. So I think some other high points are the average time between initial surgery and revision was 4.2 weeks. Our median age was 59 with a range of 51 through 73, with 50% female patients, 50% male patients. Our wound sizes ranged from 5 centimeters by 1 centimeter to 15 centimeters by 5.5 centimeters. So as you saw on the previous slide, we kind of break them down by our smaller surgical wounds versus our larger surgical wounds. Each case involved at least 3 comorbidities, with hypertension in 83% of our cases. And as we said in our introduction, many of these patients, ending up with infections and the need for revisions are our more complex patients with comorbidities. And so this definitely held true for our patient population as well. One case did experience a postoperative seroma development, while the remaining 5 covered without complications, and the seroma ended up being drained and the patient was fine. Notably, a challenging case involved a 62-year-old female who underwent a lumbar interbody fusion with posterior hardware 4 months before it got infected, so it necessitated a revision closure. And so 4 weeks following the initial revision, she got infected again. And so we went in for a second revision used the fish skin graft, and it ended up being successfully healed. So kind of in conclusion, we obviously know these revisions are challenging cases, and our case series just really highlights the effectiveness of this fish skin graft in promoting wound healing. Further exploration is definitely warranted to kind of figure out all of the potential benefits, especially saving the healthcare system costs, right? And then really just integrating this biologic onlay into these procedures. I think it's also important to point out that so many advancements have been made in medicine, and this is not some miraculous cure all, but rather just like an extra step in these complex patients that we can take to help prevent the need for revisions. It's also important to note that this is not just a solution for spinal revisions. There's a great article published on the use of this fish skin graft in diabetic wounds. And so I think it's an innovative solution that can be widely applied. The next step for our team is definitely to get a larger patient population and just continue to track our outcomes. So this really concludes my presentation.